This is Reset. I'm Sasha-Ann Simons. Now, if you're in need of mental health care, what do you do if there isn't anywhere to go for services in your community? That's the reality for so many people, especially Black and brown folks living on Chicago's South Side. According to the Chicago Department of Public Health, 65% of Black and Latino Chicagoans with serious psychological distress, they're currently not receiving any treatment. And in 2012, the city closed half of its public mental health clinics, many on the South Side. But that is slowly starting to change. This week, some South Side neighborhoods will have access to a new mental health clinic opening at Insight Hospital, the former Mercy Hospital. Now, to learn more, we're here with Nestor Flores. He's the Vice President of Behavioral Health Services at Ada S. McKinley Community Services. That's a nonprofit organization working to strengthen communities around Illinois, Wisconsin, and Indiana through several mental health, youth, and employment programs. Hey, Nestor, welcome to the show.
Hi, Sasha.
So before we talk about that new clinic,
Sure.
we do have to talk about the need that I mentioned, right? It's easy to say that, people need mental health services everywhere, but explain why the need is so strong here on our South Side.
Well, I'm a practicing therapist, and I grew up in the South Side of Chicago. So I have 50 years of that experience, lived experience, and I could tell you that the need is still there. It's always been there. That's when we talk about the daily stressors that everyone goes through, lacking basic needs. I heard a housing conversation earlier, but it's also, food, it's safety, and then just not being able to manage those stressors, and then not having a place to go to, add to your toolbox. How do I learn how to deal with this?
It's also pretty significant that this is coming to Insight Hospital too, right,
Yeah.
Nestor? Because not even 4 years ago, the former Mercy Hospital was filing for bankruptcy. And
Absolutely.
it was on the brink of closing.
What it points to is that if you invest in an Insight Hospital and Ada S. McKinley and these initiatives, that we could establish safe spaces to meet the need. And so it's great. We're excited about it, and it's a great partnership.
Now, if neighborhoods don't have a mental health clinic, what are the alternatives?
One of the programs that we have at Ada S. McKinley is it's clinician-based services or community-based services. What that means is that if someone needs their services at their home, we visit and we meet them where they're at.
Mm-hmm.
We've also met people like in public spaces, or we'll rent a space in a library and where it's confidential and do some work there. Because it's not just therapy, it's also case management. So basic needs, how can we support that? And we go where they're at. We go where the action is.
So why aren't the alternatives enough in this case?
What alternatives?
When we talk about like where people go when there is no mental health service near them.
I think our strategic plan at Ada S. McKinley is to meet the need, the existing need. It's not even more than that. And so we built 4 clinics in the last year, and we're thinking of the 5th one right, for next year. So that's not going to stop. As far as not enough, the South Side has traditionally been underserved. I mean, there's more providers in the North Side for whatever reason, and Ada S. McKinley just, we did a pulse check a few years back, and we realized, okay, we need to scale up, and we've been doing that.
So where exactly will this new clinic be?
So it's the 6th floor of the Insight Hospital. It's a community mental health clinic, and then again, it's our 4th one in the past 2 years. Yeah.
Now, the kinds of services that folks can expect when they show up.
I really wish, or hopefully here extending an invite for you to visit, because when you walk in, you're seeing what we're calling therapy suites, and they overlook the lakefront. So you're actually getting this sort of downtown experience. Everything's new, everything's beautiful, and it's for people who have insurance, no insurance, underinsured, and the idea is to create these safe spaces. Again, we really want to showcase that. Really proud of that, and easily accessible.
And in addition to the beautiful view, you're also offering some combined health services, right? So it's more than just that therapy that you mentioned.
Absolutely. So it's 15 therapy suites, but in addition to that, we're creating a crisis hub where we provide mobile crisis response services 24 hours a day, 7 days a week, 365 days a year. Ada S. McKinley is already the biggest provider of that in the South Side. We're just creating this new hub at that location.
Wraparound intensive care coordination for at-risk youth as well, right?
Yeah, absolutely.
That's your Pathways to Success program.
Yes,
and
much needed.
Yeah, much needed. And you've got outpatient psychiatric support, including medication monitoring. That's another big one as well. Folks, if you're just tuning in, this is Reset. I'm Sasha-Ann Simons, and our guest in studio is Nestor Flores, who is Vice President of Behavioral behavioral health services for Ada S. McKinley Community Services. And we're talking about the lack thereof of mental health care access on the South Side, and a brand new clinic that'll open this week to help address that need. So this is the fourth, as you mentioned. You already teased that you're looking at a fifth. What can you tell us there?
Always. I run community mental health clinics like a startup, and we have this sort of energy of like entrepreneurial and strategic. And the reason that works for us is because traditionally social service agencies tend to kind of get stuck in like, how could I get funding? How could I make this sustainable? So we have a really, really very important strategic plan. And I'm, like I said earlier, I'm personally motivated by this. I grew up in these communities, and there's still a lot of anger. There's still a lot of high suicide rates, self-harming, and that drives us. That drives the mission. Our actual mission is to help individuals and families achieve the healthiest version of themselves. So how do you do that? And it is by creating these spaces and these services.
I mean, it touched me when you talked about the anger that you're still seeing among people. I mean, how does it feel for you to know that you're then offering a solution,
right?
A possible solution to these issues?
I'm glad you're asking, because the thing with anger, just to pick an emotion, right? There's all sorts of emotions. I'm a therapy geek, so I won't go there. But let's just stay with anger. We're really sympathetic when anger is turned inward. So that's the person who's angry at themselves, self-hate. So then you're self-harming. Again, that's where suicidal thoughts show up. And there's treatment for that. But there's also the anger that is expressed outward. And that's the one that leads to sort of criminal justice involvement or acting out or violence in the communities. That also needs treatment. The source is still the same. And behind anger, there's actually sadness. So why are these youth sad, right? And that's what we start talking about in these safe spaces.
And expanding access to mental health care, that's also been one of Mayor Johnson's priorities. He's talked a lot about this.
Yeah.
As much as the city and the state want to prioritize access to mental health care, though, I mean, is there more that you think that needs to be done to address the shortage of workers, behavioral health workers?
Yes, you have to be really creative and strategic. Like I've said earlier, for example, Ada has recruited nationwide, and so that helps. And we have competitive salaries. That's also important. And we have our One Ada culture, which means creating supportive spaces, not just for the person served, but for our staff as well. And so that, I think, is what has allowed us to staff. We actually don't have any staffing issues right now.
Right.
Yeah.
So the clinic opens this Thursday. What should the community know? And when will you start taking in more people for care?
So get this. We already did our soft opening to, workout operations a month and a half ago, and we're at 50% capacity.
Wow.
So what I anticipate with the public grand opening is that people will get our number. They'll be able to go to our website and request services and start providing that.
Wonderful.
Yeah.
Nestor Flores is Vice President of Behavioral Health Services for Ada S. McKinley Community Services. Thank you so much for taking the time to join us.
Absolutely. Anytime.
Good luck with the opening.
See ya.